Welcome to Nursing 508, Module 1, the role of research and evidence-based practice for advanced nursing practice. In this module, we'll be discussing the role that research and EBP plays in advanced nursing practice. I suspect that many of you are less than enthusiastic about this course, but hopefully before too long you'll see that research and EBP are vital to providing quality care as a nurse practitioner, something I'm sure all of you are very excited to do. There are 12 official course objectives listed in the syllabus which shaped this course. However, they all boil down to the two main goals I have for you when you complete this course. One, that you'll be able to perform research that impacts practice and outcomes, and two, that you will be able to appraise research adequately to perform evidence-based practice. I've yet to meet a nurse practitioner student who doesn't want to provide high-quality care to their patients. I think we could all agree that evidence-based practice is the standard for providing high-quality health care. Therefore, I hope that you are beginning to see that the information in this course is vital to a successful nurse practitioner practice. Some of you may go on to perform huge research studies that broadly influence nursing science and practice. Some of you may never participate in any research. I suspect more of you will end up participating in research than you realize now. However, even if you never end up performing research, you will need to understand the research process. You will all, as nurse practitioners, be consumers of research. Every time you read an article reporting the best practice standards for a particular disease process, you will need to know whether it's reliable information. In order to be an informed consumer of nursing knowledge, you must understand how to assess and appraise that knowledge. Without understanding the process through which the knowledge was developed, you will be unable to effectively assess and appraise that knowledge. All of the information in this course is applicable to both performing and consuming research and practice evidence. There are many sources of information that you are bombarded with, and as a nurse practitioner, the amount of information that you are faced with will only increase. Understanding the research process will provide you the ability to be an informed consumer of knowledge and enable you to apply the best evidence to your patient care. In your current practice, do you ever find yourself thinking, why do we practice this way? Or why do we perform this technique on every patient? Or even, why do we only do this with some patients? How many times have you heard someone in healthcare say, that's the way we've always done it? As nursing has evolved as a science and healthcare has progressed, the reasons that we used to cite for doing things are no longer acceptable. Nursing is an evidence-based science. Our nursing care needs to be based on the best research evidence available. Evidence-based practice is now the standard for all healthcare professionals. Evidence-based practice is not cookie-cutter practice. Too often, many healthcare professionals think that we need to do exactly what the best research evidence tells us to do for every patient under our care. We need to remember that there are other factors to consider, such as an individual patient's preferences, values, and beliefs. While this course focuses on the best research evidence and how to determine what that is, it is vital that we always keep our patients' unique characteristics, beliefs, and desires in mind. The Lowy article that I included in this module's required reading outlines some concerns about the need for individualized care being lost in our efforts to provide evidence-based care. These challenges are but a few of the many associated with performing evidence-based practice. Research databases are not always comprehensive, so you need to check multiple databases to even locate all of the evidence on any given topic. In addition, we are living in a time where there is more information becoming available each day than any one person could ever keep up with. All this while at the same time nurses and nurse practitioners are facing stricter and stricter patient care constraints and increasing demands for service. Another difficulty faced when trying to transfer best evidence to your clinical practice is determining how best to apply that evidence to your specific patient population. Don't worry, you will be able to overcome the many challenges and learn to both perform research and apply evidence-based practice in your nurse practitioner practice. In this course, we will learn about the various types of research. We will explore how to determine the purpose of your research or your research question. Each of you will identify a practice question that you want to explore and which you will write an EBP paper on. You will become aware of the many ethical considerations of performing nursing research. Each of you will complete the training that is required of anyone performing research with human subjects. You will learn how to collect and analyze data and how to disseminate the findings from your research. You will perform qualitative data collection individually and analyze that data within your discussion groups. You will also compile a poster abstract on your EBP paper topic to learn about how findings are disseminated. At this point, you may be saying to yourself, I have no plan to perform research. Why would I want to learn all of this? You need to know all of this even if you don't want to perform research so that you can evaluate the research results that you will undoubtedly be exposed to as a nurse practitioner. If you don't fully understand the research process, then you won't be able to assess the research findings and know whether or not they should be applied in your practice. In this course, you will also learn about how to perform a literature search. There is such an overwhelming amount of information available that it is important to learn how to locate the information that is applicable to your research or EBP topic, and you will need to do this when preparing your EBP paper. You will learn how to evaluate the evidence once you do locate it to know whether or not it is strong evidence that you want to apply in your nurse practitioner practice or not. You will learn methods for organizing the large amount of evidence that you find and how to synthesize the evidence findings. Your final paper will include a literature review matrix that summarizes the evidence on your topic and the strength of that evidence. You will also learn about the process of implementing evidence-based practice. I hope that you're not feeling too overwhelmed. I have the utmost confidence in each of you as we begin our journey to learn about the application of research and EBP to advanced practice nursing. As nurse practitioners, you will all be consumers of research. Throughout this course, we will explore the knowledge and skills necessary to both perform and critique research and apply it to practice. We will take small aspects of each concept and address them as we go. Please be sure to post any questions or concerns you have under the course communication tab. Thanks.